All right, so we're going to talk about glaucoma and different diseases in the anterior chamber of the eye. So the first thing we're going to talk about the anterior chamber is this part right here. So we're going to talk about the two diseases in this part of the eye. One of them is glaucoma. Glaucoma, and there are two types of them actually. There is open and closed. So open-ended, as you know, that the aqueous humor, it goes from the ciliary bodies and then it comes out and drains in the trabecular meshwork. So this is the aqueous humor pathway, and the open, we don't know what causes it. There's a primary and there's a secondary. The secondary is due to the trabecular meshwork. Trabecular mesh is blocked by different kinds of white blood cells, red blood cells, etc. Due to, you can get red blood cells in the uveitis, or which is like inflammation, uveitis, inflammation, okay. And then the closed is when there's a problem in the lens. So the lens is either pushing against the iris, which is pushing into the cornea. So either due to large lens, fluid builds up, large lens, okay. So the fluid builds up, so instead of, it can no longer go forward like this. So this fluid builds up and it starts pushing the iris into the cornea. Pushes the iris into the cornea. And there are two kinds of them. There's a primary and the secondary. Primary is basically large lens. Secondary is hypoxia. So either there is some kind of a iris has vasoproliferation, hypoxia due to diabetes, or it is some kind of occlusion, has vasoproliferation, and angle is contracted. So the angle is shortened or shortened. Okay, so these are the two kinds of glaucoma that you have here. You have an open one and a closed one, okay. Open one, the cause is unknown. The primary is cause is unknown. The second one is the trabecular meshwork is blocked by infection or red blood cells, and so it can no longer flow. The second one is either you have a really big lens that is pushing against the iris, or the iris has really become large and it's contracted, so it's getting really close to the cornea, and that's why you cannot flow. So basically, those are and it builds up the pressure inside the eye, so in the aqueous humor. So this is glaucoma for you. The second one is cataracts. Cataract. And cataract is basically lens is opaque. Okay, it's bilateral, painless. Okay, obviously you have decreased vision. Risk factors can be obviously diabetes, neurofibromatosis 2, torches, of course, myotonic dystrophy. So these are the main highlights for the anterior portion of